So the Eastern Cooperative Oncology Group is one of the 4 adult cooperative groups that are involved in conducting trials for patients with cancer. And I'm happy to say that the Thoracic Committee at ECOG is in the forefront of developing targeted treatments for patients with molecular targets, treatment options for patients who do not have a fully defined molecular target at this point. We're invested in understanding and improving treatment options for patients with every stage of lung cancer, small cell, non-small cell lung cancer. In stage 4 disease, obviously there are a lot of exciting ideas, a lot of exciting new drugs in lung cancer. We're in very good shape in terms of the available options for research setting and also in clinical setting in the past few years. One set of strategies we're working on focus on patients with EGFR mutation. What is the best way to take care of a patient with EGFR mutation? We know that the Tarceva and Gelotrif are approved options. They work well for a certain length of time and then patients develop resistance. So how can we delay resistance or prevent the emergence of resistance? So we have a novel combination study that involves a histone deacetylase inhibitor with erlotinib that's in development, and we hope to roll this out very soon. The next plaguing question is, what about patients who've already developed resistance to Tarceva? They have a mutation, they got the drug, after several months they've developed resistance. So we are now developing a randomized trial which involves a very promising combination of afatinib and Erbitux that, based on scientific data that have come out from Dr. William Pau's laboratory at Vanderbilt, and has been substantiated by a phase 1 study with about 100 patients where this shows promise. So we're going to be doing a randomized trial with that combination from the group of ECOG investigators through a mechanism called PRECOG, which is available to all ECOG investigators. Then when you look at patients with EGFR wild type, we have an ongoing study looking at a new drug called cabozantinib in combination with Tarceva. That study is almost 2/3 of its way done, and we hope to have results from the trial next year. Among the other studies that we are looking at, we clearly are excited about the potential for agents that target the immune system. So we have a couple of ideas on what's the best way to move them a little further earlier into the setting. So there are some study concepts we're looking at. We have some concepts to look to treat squamous cell patients. We have an ongoing trial that involves targeting FGFR, a fibroblast growth factor receptor inhibition, in patients with squamous cell who have that receptor amplification. That's probably about 10 to 15% of squamous cell tumors. So there's an ongoing trial for those group of tumors. So these are some examples of studies that the Eastern Cooperative Oncology Group is doing to what we call divide and conquer strategy. Not treat every patient the same way, but see what's unique about them, develop an option for those specific subsets of patients, and try to maximize the therapeutic benefits of the agents we have.